So this is question number 6 in the 2003 paper. True or false regarding corticosteroids? This question is on steroids. They have anti-inflammatory effects. That is true. They have anti-inflammatory effect. They reduce inflammation. Topical applications do not cause adrenal suppression. That is false, because certain steroids, when you apply on the skin, it get absorbed to the body. You get absorbed, then it goes to the kidney and make the suppression of the adrenal gland. Adrenal gland is suppressed. So less production of natural corticosteroids in the body. C. Hydrocortisone is a naturally occurring corticosteroid. That is true. Hydrocortisone is a naturally occurring. Not very potent as other steroids. Fluorinated steroids are more potent than hydrocortisone. Hydrocortisone is the natural one, natural steroid. So they added a molecule of fluorine, atom of fluorine into the structure. So after that is called fluorinated, because now the steroid atom contains the fluorine. So what happens is the potency increased very rapidly, more potent. With us now you can see 5 milligram tablet of dexamethasone, for example, is very small, but the action is very high. It causes osteoporosis is one of the side effects of steroid therapy. When you take dexamethasone, that it acts very fast and patient get fractures. So dexamethasone is more effective than prednisolone. So other ones are betamethasone, dexamethasone. These are very, very, very highly active than prednisolone, because they have a fluorine part in the molecule. This part may be a little bit complex for you, but try to read it, because it is above the expected knowledge of functional pharmacists, but little bit better to know little bit more than the average. Hydrocortisone is a prototype. Prototype is the basic part of the drug, the first drug. Prototype, the very basic, what was identified first. Then prednisolone, methyl prednisolone are active as highly active. Then they are highly active than prototype. Then fluorinated came, dexamethasone, betamethasone, those are very highly active. This part you don't need. So fluorinated steroids are very potent. So prednisolone, when you take prednisolone and dexamethasone is far more active than prednisolone. Their long-term use in children is known to cause growth retardation. So in children, that is true. Growth retardation is important. Is one of the side effects. Corticosteroids are available in as tablets, as injections, as inhalers, lotions, gels, creams. So those are for topical. So all these are available. And the side effects of steroids are very high. One is they can interfere with carbohydrate metabolism. That means patient can go to diabetes. They in the body, the weight gain is one reason. They get more appetite, eat more, and there is some fluid retention also in the body. So they when they take a high dose for a long time, they get moon face, that is round, the cheek muscles become larger. Then in children, the growth retardation is one of the side effect, but not for a short course when they take it for a long time. And also, it can cause osteoporosis, bone fracture, and also, if you take steroids for longer time, say longer than 1 week, you have to tail off it. You can't suddenly stop prednisolone or any steroid, gradually stop it, because you are suppressing the adrenal gland, stop the production of natural steroids. So when you suddenly stop, you don't take and you don't have the normal production also. So let the kidney produce, that is adrenal gland produce prednisolone, gradually increase. Then if you take less and less amount, the gland also will adjust it, producing more and more. So tailing off is important. ටික ටික අඩු කරන්න ඕනේ, නැත්නම් ඇඩ්‍රිනල් ග්ලෑන්ඩ් එකේ හදන නැචරල් ස්ටෙරොයිඩ් නැති කෝටිසෝල් අඩු වෙනවා. එකපාරට නැත්නම් නැචරල් හැදෙන එකක් නෑ, අපි ගන්න එකක් නෑ. බොඩි එකට ඉන්සෆිෂන්සි එකක් එනවා. 7. True or false of drugs used in thyroid disease. In thyroid diseases are two types mainly. Hyperthyroidism, that means thyroid gland is working fast, producing too much of T4, thyroxine, and T3. Hypothyroidism is thyroid gland is not working as expected, so producing less thyroxine. This is controlled by TSH. In thyroid gland, roughly hypothalamus, thyroid releasing hormone, this produce thyroxine, so hypothalamus release thyroid thyroxine releasing hormone to the pituitary. Pituitary gland. From pituitary gland, so the pituitary gland release TSH. This is TSH. This is thyroid gland. So now we check TSH to check whether the patient has a thyroid disease. So TSH is not a thyroid hormone. This is what you have to remember. TSH is produced by the pituitary gland. So hypothalamus release thyrotropin. This mechanism is on the T4 level. T4, so thyroid gland release T4. T4 and T3, mainly T4, but T3 is more active than T4. So these ones will increase. T4 and T3 has a negative feedback. Negative. This is also negative. That means when the T4 T3 is enough in the blood, they will inhibit hypothalamus producing thyrotropin releasing hormone, that is called TRH. And then TRH is produced less, and also they suppress the pituitary gland producing TSH, thyroid stimulating hormone, that will, so this is called negative feedback. So this is like seesaw. When the thyroid, okay, now these are the active part of it. T4 and T3. T4 when it is low, that means low T4 is less in the blood. That means thyroid gland is not producing enough T4. That is called hypothyroidism. Sometimes the thyroid gland is working very fast, like a raced vehicle. So then that means T4 is, when you check in the blood, T4 is now increased. That is called hyperthyroidism. So hyperthyroidism and hypothyroidism are those. In a child, question, we'll go to the question number 7. A, in a child with hypothyroidism, thyroxine is given throughout life. That is false. The child can later produce enough thyroxine, enough T4, then patient will be okay. There is no guarantee that you have to take the thyroxine during the whole life. So when in hypothyroidism, we give in hypothyroidism, not enough T4, we give thyroxine. So thyroxine, you know how to take it. Take it in the morning, empty stomach, and then for 30 minutes don't take any food or drink. So you have to take it fasting. So hypothyroidism, you are on thyroxine. B. Carbamazepine contraindicated during pregnancy. Okay. For hyperthyroidism, that means the thyroid gland is working very fast, producing more thyroid, T4. That is also very bad. Patient get faster metabolism. So, hyperthyroidism drugs are carbimazole, metamizole, propyl thiouracil, propyl thiouracil, uracil. So these are the drugs used in hyperthyroidism because you have to stop producing T4 now. Reduce, stop, reduce the thyroid gland. There are three ways to stop that. One is surgery, cut out half of the whatever majority of thyroxine gland. The other one is radiation therapy. What is the radiation therapy we give? Radioactive iodine. I-129 iodine. මේ සමස්ථානිකව දෙනවා. ඒකට මේකෙන් පිට වෙන රේස් වලින් බීටා රේස් වලින් මේ thyroid gland එක තියෙන cells විනාශ කරනවා. thyroid දැන් හදන්න විදියක් නැහැ T4. thyroid gland එකට iodine එකතු වෙනවා. එකතු වෙලා මේක සෑහෙන දුරට විනාශ කරනවා. මේක බොන්න දෙන එකක් ඉන්ජෙක්ෂන් නෙමෙයි. දැන් අනිත් විදිය දැන් එක විදියක් සර්ජරි අනිත් එක මේක අනිත් මෙතඩ් එක තමයි මේ ටැබ්ලට් දෙන එක. මෙන්න මේ වර්ග තුනෙන් එකක් දෙනවා. මතක තියාගන්න ප්‍රෙග්නන්සි වල දෙන්න පුළුවන් මේක විතරයි. ප්‍රොපයිල් thiouracil විතරයි ප්‍රෙග්නන්සි වල දෙන්නේ. උඩ දෙකම දෙන්න බෑ. ආල්මසෝල් දෙන්නත් බෑ මෙතමසෝල් දෙන්නත් බෑ. ඒකට ප්‍රෙග්නන්සි වලදී ප්‍රොපයිල් thiouracil විතරයි patient කෙනෙකුට ගන්න පුළුවන්. හරි. දැන් බලමු B. Artemisole is contraindicated during pregnancy. Oh, that is true. දැන් දන්නවා. Propyl thiouracil is effective in treating hypothyroidism. That is false. Hypothyroidism means not enough T4 producing by the gland. So propyl thiouracil is given to reduce the production of T4. T4 හදන එක අඩු කරන්න දෙන්නේ propyl thiouracil. මේින්ද ඒක false. B. The cooking salt, sodium chloride, Sri Lanka iodized to reduce hypothyroidism in our population. That is true. Iodine දුන්නම thyroid gland එකට දෙන T4 හැදෙනවා. If a woman gets pregnant while on thyroxine, the drug should be discontinued immediately. This is another story. Now, if a woman gets pregnant, then the woman has to take thyroxine for the mother and also for the baby. Then you have to choose. Then add after getting pregnant. Add 25% to the dose. Now the mother has to take little more for the child also, for the baby. So that is, if the mother has taken 100 milligram, 100 microgram, then use 120 with pregnancy. After delivery, again go back to the same dose, 100. So during pregnancy, take the increased amount of thyroxine. Now this is false. 8. True or false of hormonal contraception. Combined oral contraceptive pill is contraindicated during pregnancy. That is not contraindicated, but normally they don't take it. Contraindications are 6 weeks postpartum, that is after delivery, they should not use it for 6 weeks. Smoker over age of 35, smoker, and hypertension, systolic 160 and diastolic 100. That is one condition, they can't take the tablet. Then current or past history of venous thromboembolism, then ischemic heart disease, history of CVS, cerebrovascular accident, complicated heart diseases, migraine, breast cancer, current or then diabetes with retinopathy, complicated diabetes. Normally better to avoid diabetic, cirrhosis and liver tumor. See, these are the conditions they cannot take the pill. Now, combined oral contraceptive pill is known to promote development of high blood pressure. That is a question. That is not in the literature, can't find it. So it is considered as false. This contraceptive pill has side effects. Intermenstrual spotting during the normal time, blood spots, nausea, breast tenderness, headaches, migraine, weight gain, mood changes, missed periods, and vaginal discharge. These are the common ones. There are some more. It can cause breast cancer, can cause thromboembolism, heart diseases. Northistrone is an estrogen compound with in the combined oral contraceptive pill. Northistrone is not in the contraceptive pill. That is false. That is in the 72-hour tablet. Monophasic pills, every pill contains the same levels of estrogen and progesterone. That is the explanation for this answer. Basic pills, the level of estrogen and progesterone in the pills change throughout the cycle. That is, if I have one image anyway. In basic pills, that is, first 10 days, one strength of tablet, second stage, another strength, third stage, another strength. So different. Right. there are low estrogen containing pills and 28 tablet pill and 21 tablet pill. 21 tablet pill, there is 1 week of no tablet period. 28 tablet packet, you get iron ferrous sulfate for 1 week, and rest of the tablets are for with the hormone. Low estrogen pills contain 20 microgram of ethinyl estradiol. B, the first emergency contraceptive pill is recommended to be taken within hours of sexual intercourse. 2. Within 72 hours. Emergency contraceptives, 2 types. Three days means 72 hours. Then they can use the IUD. Okay. Last question, that numbering is wrong. The risk of venous thromboembolism increases with an increase in the amount of progesterone in the pill. That is false. Actually, estrogen is the risk factor. Question number 9. A lady of 50 years is prescribed with lente insulin. True or false regarding the instructions that should be given to this lady? A, the insulin vial should be stored in the deep freezer. That is, everybody knows that is false. If she is ill with fever, insulin should not be taken. That is also false, because even if the patient is on tablets during the ill period, they are started with insulin, because high blood sugar promotes any infection, especially bacterial infection. So in the hospital, they start insulin for everybody. Even if they take tablets, they start with insulin. So the B is false. C, the dose of insulin should be administered subcutaneously. That is true. Previous one we have seen that. If she feels faint, she should take some sugar immediately. That is true. It's a common question. Control of her diet is not essential as she is on insulin. That is false. You have to be very careful, especially when you are on insulin and sulfonylurea. Then question number 10, salbutamol is a beta stimulant. That is true, beta 2 stimulant, agonist, not blocking. When the beta 2 receptors in the lung airways are stimulated, it gets dilated, bigger in size. B, cause bradycardia. Salbutamol cause bradycardia, tachycardia. Heart rate goes up for a minute, generally 72 to 100. So this goes to sometimes more than over 100. C, is used in nebulized form to treat acute asthma. That is true. Salbutamol is one of the drugs that is used in the nebulizer. Should not be used by patients who are also taking steroid inhalers. That is false. And E, the last one, has anti-inflammatory properties. No, anti-inflammatory properties are from steroid part. Take different steroids as inhalers, or they can take oral tablets, prednisolone. O-methyl prednisolone. So the E is false. Okay, thank you very much.